Failure to provide adequate health care by government, the hospital, or neglect by a medical doctor will lead to prosecution. It follows a landmark ruling by the High Court judge in which he ordered Nakaseke Hospital to compensate a family which lost an expectant mother in labor in what has been described as violation of patient rights. Makerere University Law lecturer Professor Ben Twinomgisha told the media that when the High Court rules on a matter, its decision is binding on all government agencies. To that effect, the law Don explains that this judgment now binds government provide adequate funding to the health sector to minimize unavoidable death since it's signatory to regional and international health treaties.
The rights of the deceased and the children had been violated. For the first time in the history of this country, we've received a case that positively rules about the state's or its organs' obligations to protect the right health and associated health rights.
This was after Nanteza met her death 8 hours later after waiting for Dr. Davis Mubezi, who was supposed to be on duty on that fateful day, whereas nowhere near the hospital to attend to her. The deceased had developed obstructed labor that needed the services of a professional doctor.
Kakati bamutute musheta dokita teyajirawo nze ngenda waliwo sister wange bweru weddwaliro ne mugamba baba nfunye obuzibu naleese omulwadde omukyala wange okuzaala naye okuva namuleese tanafuna buyambi bumala abasawo bagamba dokita alina omulongosa taliiwo.
The woman is in pain of labor, the labor is obstructed, the labor becomes obstructed, and at that point not even a traditional birth attendant or a nurse or an untrained midwife can handle such a woman.
Justice Kabiito further observes in his judgment that the deceased's right to access appropriate medical and health services were violated. The judge also observed that Nanteza's 3 children were deprived of their motherly care due to the hospital's negligence, for which they were awarded damages. Mityana District Woman MP Livia Namabide welcomed the landmark judgment but advised government to mind about saving people's lives instead of being ordered by the court to compensate those who have denied out of negligence. The MP also wondered why Dr. Mubezi was not personally held liable for the death of Nanteza but instead chose to hold the hospital liable.
How do we hold the health worker, that doctor, account fact that she spent over 8 hours in labor? A doctor who could not come, who was saying I'm coming and was not coming.
This landmark case was lodged in court by a civil society organization, Center for Health, Human Rights and Development, CEHAD, alongside the deceased's husband, David Mugera, and her children, Gloria Nantongo and Susan Nalkwago. Medical statistics show that 17 pregnant women die on a daily basis from preventable maternal death in Uganda. The leading causes of maternal death in Uganda include massive shortage of trained, motivated and equitably deployed professional health workers to attend to birth, lack of access to emergency obstetric care, lack of access to quality antenatal care, and lack of family planning services.